Welcome to the Susan Brender Show. It's all about you, featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today I have the privilege of interviewing Dr. Stacy Godes. Now, she chose to pursue a career in the dental profession as a way to help people achieve their goals related to overall health and well-being. There's so much for us to talk about, but I just want to introduce her and say hello, Dr. Stacy Godes.
Hi, Susan. It's great to be here today. Thank you so much for having me on the show. I have a lot to talk about, and I'm here to educate the public.
Well, that's why I call it a privilege, because you are just full of information that is so important for people to understand. So let's start out by talking or actually asking you to define what a holistic dentist is.
Okay, perfect. I know a lot of people ask that question and they're unsure. Holistic dentistry also can be referred to as alternative dentistry or unconventional dentistry or biologic dentistry. It actually emphasizes approaches to dental care which consider the patient's dental health in the context of their entire physical, emotional, and spiritual well-being. So it's part of the alternative health movement. And although the holistic dental community is diverse in its practices and approaches, there are definitely common threads that include things like strong opposition to amalgam, which contains mercury and other toxic materials in the dental fillings. We approach gum disease in non-surgical ways. We believe that root canals may endanger systemic health of the patient, and many practices and opinions among alternative dentists are criticized by the mainstream dental community, but we're here to educate and help people in their overall well-being, and the dental aspect is just one part of it.
Now, Stacy, this is an important thing for our audience to understand. You, as you suggested, or as we know, you're a holistic dentist, but the reality is that you also have a deep passion for health, fitness, and nutrition in your personal and professional life. Now, putting those things to a kind of test, how would you define what you consider good nutrition for the body, for everybody?
Well, that's a tough question in a certain sense. I do focus a lot on nutrition in my practice because I feel that the state of your health basically begins in your oral environment. And so it's not just about the fillings and things that you may have in your mouth, but what you put in your mouth to feed your body. There are a lot of trends out there, a lot of different diets. We all, I've been a fitness competitor before in my past, a competitive gymnast. So I've always resonated with optimal health and how performance is enhanced by the good things that you put in your body. So it is when we talk about oral health and we talk about systemic health, it's one and the same. We have to educate patients about doing the things that make their bodies perform better. And so we talk, it's an individual basis. It's not one diet that fits all. I love, talking about nutrition to different, local societies here in California, Southern California. And, I look at different ways to make somebody think about and be conscious and aware of the things that they're putting in their body. For instance, I have tons of books on all the different, low fat, high fat, keto diet, low carb, high carb, and it's very confusing out there for most patients. So I just say on a consistent basis, just be conscious of the things that you put in your body. So if you cheat here and there, it's okay. But we have to focus on greens and organic foods and water, the kind of water, carbs. They're not all bad carbs, high fats, that, can help your brain power. There's so many different ways to lessen the acidity of your body and different kinds of foods that will affect that. And we talk about all that too. When it comes to teeth, teeth are extremely important to chew if people don't have teeth. So that's going to affect their chewing function and what they're able to eat. So, it is one of the biggest topics that I do talk about in my new patient exams. So,
yeah. Now, hold on, Stacy. You mentioned the word mercury. Now, there are a lot of controversy over the issue of mercury. And so I'm very interested in understanding why mercury is detrimental to people's health.
Well, so every week we get a lot of questions and emails regarding mercury and patients wondering how it affects their health and how is it bad. Are there any safe ways to remove it and the benefits of removing it? And, let's start off with answering, is mercury really bad for you? And, here are some concerns that you may have. First, in every doctor's mind is the protection of their patient from exposure to mercury. So that's why we have great air to breathe in our office. We have ionizers everywhere. We have essential oils, things of that sort. But this is, true of the mercury toxic patient because they've been exposed to varying amounts of mercury from their diet or their environment or their employment or from mercury or amalgam silver dental fillings. And it's really the vapor that is leached out from these over a period of time. We've all heard from the FDA that recommends that women who are pregnant limit their consumption of certain seafood due to the risk of high mercury levels. So we know mercury is toxic and we shouldn't eat it. But what about the mercury that's in your mouth? Some people that, if you've already had amalgam fillings in your mouth, you already have mercury embedded in your teeth. And mercury is at its most toxic when the filling is placed and when mercury vapor is released into the air. So even if you aren't getting the filling, you could still be inhaling the vapor. And so we really take precautions. There's protocols in our office to actually remove that. You need to go and make sure that you go to a dentist that removes the mercury properly and uses a certain protocol, uses certain nutritional supplements to bind that metal when they do that. There are a ton of research articles out there that, scientific articles that support that thinking and how mercury can be hazardous to your health.
Yeah. Now, that's an interesting answer because so many people talk about the issues of mercury. But let's move forward. So do you use technology in your practice? And if you do, what technology do you use?
Well, we love technology in our office. So we use digital x-rays. We have one of the newest things we incorporated last year is the CEREC machine, which is almost like I describe it like a 3D printer basically to make crowns and bridges and implants, things of that sort, cosmetic smile designs in one day. It's like a milling machine that we have in the office, which means that you're able to get a crown in one day. So you don't have all that goopy material. You don't have to have temporaries, impressions. It's phenomenal technology. One of 500 dentists basically have this, and we love it. It's changed the way we practice, changed the way that we present our dentistry, and we're very proud of that.
Yeah. Now, we have a lot of people in the world who don't practice or don't have any opportunity to have somebody work in their mouth and give them the kind of help that they need. So what do you say to people who say, well, going to a dentist today costs a fortune of money? I mean, it's not cheap. Does insurance cover dental care? And what about poor people? Can they get dental care somewhere? What do you think about that?
Well, absolutely. Insurance is a funny thing. We do take dental insurance. They do cover a lot of things that we do. There are some things that they don't, but at our office, I'm really passionate about making sure that I help as many people as possible. We do charities at our office too to support people that are a little, less fortunate, that aren't able to afford some dental care. So, it is expensive, and I would say that what we try to educate patients about too is prevention, so they're not having to spend a fortune down the long road. So, we take a lot of kids in our office. We educate them about being in a safe environment, coming to the dentist, not having it be stressful and fearful and creating that phobia down the road. So it's something that we're really passionate about too. I do a lot of charities out here too, and I try to educate patients about coming to me, and I'm always willing to work with patients if they're, if I feel that they're motivated to change their health, to change what's in their mouth. I'm here for them, and we'll work out something.
Mm-hmm. Now, is there a relationship to your overall health and dentistry? For example, if you wanted to, if you go to the dentist and you have your caps put on or cavities taken care of, and if they're not taken care of, what kinds of results can it have on one's body?
Well, extraordinary effects. In the last 17 years that I've been practicing, I've seen some unbelievable things that we attribute to the toxicity and infection in people's mouths. It's not only the mercury fillings, it's the root canals, it's the cavitations, it's the things that they're, poor oral health. I've seen things from mercury toxic patients to neurologic ailments to autoimmune issues to thyroid issues, because we know that every tooth is on a meridian in your body. It affects different organ systems differently, and depending on the stage in your life, if you're ever immune compromised, maybe that's when it's going to rear its head. And there are a lot of people out there with root canals, and they say, I don't have any symptoms, everything feels fine. But then I'll take a 3D x-ray and I find an infection underneath that tooth, and they don't feel it. So no one's ever talked to them about it. No one's ever explained about the dangers of root canals to them. So it's a big educational process. And no matter what else you do to improve your overall health, including removing your mercury fillings, it's important to understand how your oral health affects your overall health. And most people are unaware that oral health issues can harm their overall health. So absolutely, it really is extraordinarily how it can affect you at certain periods of your life.
Yeah. Now, you work with all kinds of people. You work with young people, you work with old people, but let's talk a little bit about kids. Kids don't think about their mouths. They don't think about their health because, they're young, and life to them is, there's so much ahead of them. But in terms of young people, what do you think would be important for you to educate them about? I mean, what is necessary for them to know about what you do?
Oh, lots of things. I love kids. I have 3 kids myself. I have a 23-year-old stepdaughter, a 14-year-old girl, and a 12-year-old boy. And ever since they were young, I've educated them about the importance of good oral health. And so I do that in my practice. We educate them about if they lose their teeth, this is what can happen. If they don't take care of their teeth, we show them pictures of root canals, for instance, that I've taken out. We talk to them about it. It's not just about brushing your teeth properly, but if you get cavities, this is what your mouth can look like. And, we don't want them to look bad later on in life. And we really stress that. We have wonderful hygienists that use alternative methods too at the office, that we can educate patients about good nutrition and alternative ways to use, coconut oils and essential oils and things that they may not already think about that they're able to use to improve their overall health. So we really take, we love kids. We love them coming to the office. It's actually a fun experience for them. And, we want to improve their health, forever. So this is where it starts.
Well, the last question that I have for you is, I'm always very sort of optimistic that things are changing in the medical field because, I mean, look at the technology that's going on and the things that you know about, say, dentistry. But I'm wondering, in a medical school or a dental school, are they starting to learn more about how to take care of people and understand about nutrition and various things like that? Because for a long time, many of the dentists, many of the doctors whom I've heard from, they say they get very little education about these new methods. Is that changing?
You know, I hope it changes more. I was in dental school back in the early 90s, and we had nothing about that. So for me, just because of my lifestyle and what I did in the past, it always interests me. So I took the initiative myself to kind of learn that. And there are organizations out there that have helped me out along the way that, other holistic dentists around the world and the country, we can go and, just get ideas and lovely speakers. But the new graduates that I have talked to now, there are a few more, I would say, with nutrition and how that affects people, but it's not what these kinds of things that we're talking about and how mercury can be toxic in root canals. They're not to that point yet. I mean, it's like any alternative medical physician where I think it's something that you have to just take upon yourself if it's out there. And that's why we're here, to educate, to let people know that there is an alternative way. But I thought about doing that too, just going to different schools and kind of making that movement so they have different classes that can at least, put something in the new graduate's head about different ways of practicing dentistry. There's not just one way, but you still find amalgams out there. Pediatric dentists still place amalgams, and so it's just a shame, but it takes people to just put it out there, let everybody know about it, and then, individually you can do your own research about it. So,
yeah. So I'd like to give you the last word because the show is almost over. What would you want to tell our audience about?
I just want to spread the word of health, spread the word that there is an alternative way to do dentistry. Dentistry and toxicity in your mouth can absolutely affect your overall health. So if you're trying to optimize your wellness, then you need to consider having extremely well hygiene. Go to a dentist that understands systemic health and how the things that are in your mouth and what's placed in there really affects your overall health. So do your research out there. There's a lot of information on my website. There's a lot of information out there for other alternative dentists in the country. And I just invite you to, just start that process, start that journey. Just take a little bit here and there and, just start educating yourself. And then you make your own decisions. But there's a lot of information out there, and that's why I'm here.
Okay. Now, if people want to get in touch with you or learn a little bit more about some of the things you talked about today, how would they do that?
So I have a website. It's Dr.Stacy.com. It's DRSTACY Godes, GODES.com. And there's my office phone number is on there. I have research articles on my website. That's the best place to get a hold of me because all the information is on there. So,
well, Stacy Godes, you are a wonderful and very educational and interesting person. So I want to thank you for being on the Susan Brender Show. Today, Stacy Godes talked about connecting holistic dentistry, health, and wellness, and it was a pleasure to have you on the show. Thank you so much, Stacy Godes.
Thank you, Susan. My pleasure.
Okay.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.